What is up, YouTube? It is Coach Kolton here to bring you physique development tools. Today, I want to walk you through on how to build your first cycle safely and also to get the most progress possible for you. Split this up into sections. One is going to be a shopping cart, what you need to get started. Two is going to be the actual first bit of it. 3 is going to be the escalation, and 4 is going to be the escalation following that. And I guess 5 is the ending. We'll call that a 5th. So we'll start with the shopping cart. And again, this is my opinion. This is what I would do if it was myself. I am not providing you insight onto what you should do. Do your own research, find a coach, get someone educated to back you in this. But here's the things I'm going to include in my shopping cart if I was to do my first cycle over again. Obviously, testosterone and enthate, preferably a longer ester, so that that ester stays within our blood for a more stable time, and we're not having to deal with very high fluctuations in blood serum concentrations of any one hormone. As well, I do want to make sure that there is no burden or taxation with injection frequency. Usually newcomers are pretty afraid of pinning themselves, so getting something that is going to require less maintenance as injection frequency is concerned is going to be a really good idea. Instead of using a 1 inch or a 1.5 inch syringe that's a huge harpoon, I'm going to recommend that you use insulin syringes. Those are going to be way more innocuous. They're going to be less involved when it comes to actually pinning yourself, and you're not going to be hurting yourself or getting too afraid of a little tiny insulin syringe. So getting a 1 cc insulin syringe is going to be really beneficial, and it's going to create way less scar tissue long term. Alcohol swabs are obviously really important to, one, clean the vial as you get it from wherever you get it from. Hopefully you can talk to your doctor about that. And also you can clean your skin with it, so we can make sure that the environment is as sterile as it can possibly be, so that when we inject, we're not causing any infection. An aromatase inhibitor is going to be really important here as well. For those of you who don't know, an aromatase inhibitor is basically what people label as anti-estrogens. It inhibits the enzyme called aromatase that takes testosterone and converts it into estrogen. So if you do develop high estrogen side effects such as sensitive nipples or a very moody sensation, you know that you can have that on the background as a player, but first, you're going to get blood work. Next is going to be primobolan and enthate. I want you to get primobolan and enthate because it is a very innocuous DHT compound we can put in later stages of this without having to burden your systemic estrogen load with too much testosterone. And then we can also inhibit reverse binding of estrogen synthesis via the primobolan. A blood pressure cuff, this is something you are now going to want to monitor a lot more frequently. I'd recommend that everyone monitors it frequently, but now more than ever, you're going to be altering things that are going to change how your physiology works. And so in such, you are going to have a higher blood pressure just baseline. So we need to make sure it's not elevating too far into that hypertensive state. So getting a blood pressure cuff, monitoring your own blood pressure once a week is absolutely essential to maintaining health and longevity within the sport. If you're just a recreational bodybuilder, it's still vital, and you don't want to die young. You want to stay alive and healthy as long as you can. So getting your blood pressure cuff, monitoring it weekly is something that you need to do to stay healthy. I do say get 2 prepaid sets of labs. You can go on Life Extension. I'll provide links down below in this video on what labs I would run at least once in the beginning before even pinning yourself for any amount, and then once kind of midway through the cycle, in which we'll talk about, to see where things are trending. A biotracker device such as an Oura Ring, which I have, or an iWatch or a Whoop band to see where your heart rate variability, respiratory rate, and things of that nature are trending. Again, these are vitally important to see how your body is managing a elevated level of androgens within its system. Some people that can develop sleep apnea rather quickly. Some people get an elevated heart rate and sympathetic drive. We want to try to avoid those things, and if they come up, we know that we need to change something within the program. Not required, but obviously the plug is there. You need a coach, and a coach to guide this whole process with you, so that when these issues do arise, if they do arise, you have someone who knows what they're doing and can intervene immediately without having you to jeopardize your health for a longer period than necessary. So now the shopping list is out of the way. You've gotten all the things you need as a prerequisite before even starting anything. You can now move on to what we'll call the first phase. And this is a starting point. So what I want you to do in this very point is get your blood work taken. This is where you're going to the lab that you've purchased labs from, or to your primary care physician. You've gotten a CBC, a CMP, you've gotten your ApoB tested, you've gotten C-reactive protein tested, you've gotten a plethora of other tests, which we can talk about if you comment down below. I'll be happy to do a video on what tests I recommend. You can see everything and the lay of the land as it is prior to you taking any exogenous supplement, creating a baseline for you to look back at as you develop into more of a higher risk model. At this point too, you're going to start measuring your blood pressure weekly, and we haven't even injected anything yet. I want to see what your blood pressure is before you even start using a compound so that we can get a good baseline at where you're supposed to be. The next part is finding an injection site that you are comfortable with and that you find easy to inject. A lot of people say the glutes. I hate the glutes. I think that's a terrible idea. I like my quads. A lot of people hate the quads, so they do their shoulders. Find an injection spot that you find easy to commit to. It's not taxing to actually inject there, and it's going to be reliable and sustainable for you to do long term. Then what you need to do is go on YouTube and find nursing manuals, and they have all sorts of them on YouTube, say intramuscular injections in the shoulder, the leg, the glute, the medial glute, the ventral glute, any of these things, and you'll find tons of detailed videos on how exactly to do that with where you need to pin and so on. I recommend doing intramuscular injections just because I've found that the oils don't interact well when I do it subcutaneous, and my skin gets a lot of irritation. So intramuscular injections are what's going to really be pushing that needle forward, literally, and what's going to be kind of safer for less irritation in the long run. As of right now, you're going to start with 2 times a week injections. So starting on what I would recommend Monday and Thursday, you can split that up however you feel fit. There's no science really needed to explain that. Monday and Thursday, do injections. Keep your blood serum concentrations relatively stable because we're using an enthate. The initial dose will be 250 to 200 milligrams of testosterone and enthate only. This is going to be high enough to initiate some of the cascades that will lead to a ton of anabolism, low enough that we're not causing physiological stress. And for honest sakes, this is most people's TRT, but it's still going to achieve a lot of results, especially if you're coming from a natty state moving into an enhanced state. This is going to be a plethora of results. And if you want to find out how much you need to inject as in milliliters, what you have to do is take the required dose. So in this instance, let's say it's 200 milligrams, and then divide it by the concentration of the drug in the vial. So if we're taking testosterone at 250 milligrams per ml, we need to take 200 milligrams and divide it by 250, and we get 0.8 ml. That is how much you'll be injecting, split into 2 injections, so 0.4 ml on Monday and 0.4 ml on Thursday. That will keep your blood serum concentrations relatively stable, and you know exactly what dose you're doing. And this is the part that gets mundane. People think they'll expect immediate results and they'll see some things that they've never seen before out of their body, which is in part true. You certainly will grow much faster and become much stronger and have a higher sex drive, but it's not so immediate. I actually want you to wait 6 months at this point before we even enter the next phase. So at this point, the next phase is going to be in 6 to 8 months. That sounds like a long time to run a cycle, but again, we're only at 250 milligrams or even 200 milligrams. With that dose, you are not going to see any derangement in health markers, I guarantee you. And if you think I'm wrong, you can quote me on that. The only thing you'll probably see deteriorate is HDL cholesterol, which I'm not super worried about. Honestly, research is a little bit skeptic on that as well. So I really believe that you will not see any derangement in health. But at this point, I do want you 6 to 8 months into this process to take that second labs that you bought. Okay, so we're going in and taking that second labs. We're going to see where things are trending from when we started, before we even used anything, till now, when we have been using for 6 to 8 months. That'll give us a clear indication of how far we can push things, and if you've even deteriorated your health at all, and what we need to do next to intervene if health has been deteriorated. At this point now, we're going to include 100 milligrams of Primabol a week. We'll also move injection frequency up to 3 times a week as opposed to 2, to make sure that blood serum concentrations are staying even more stable as we approach higher loads of androgen. And then at this point, again, we just continue for 4 more months, which seems like a very long time, but again, we're probably only at 300 to 350 milligrams. At this point, you've probably put on 10 to 15 pounds of muscle. You can quote me on that, I promise. People think 250 milligrams is too little, but I guarantee you are going to make some insane gains at this point. Lastly, at the very last elevation of this program, about 4 months later, we're going to add another 100 milligrams of testosterone as long as your physiology allows it. Now, if you've been converting estrogen really badly at 200 to 250 milligrams, okay, maybe we don't want to implement more testosterone, and instead we place and deploy some more Primabol to inhibit that estrogen synthesis. So if your nipples have not been sensitive, you haven't been overly moody or water retentive, or your blood pressure hasn't shot up, maybe we don't add more primobolan, we just shoot for a little bit more testosterone, because estrogen in and of itself is very anabolic, and as long as we can have a higher estrogen level without side effects, you'll want to do that. Run that for 3 more months. Let blood serum concentrations take about 5 weeks to get to peak concentrations after that additional dosage. Then after those 3 months, cut everything out, go drop down to a baseline TRT dose, anywhere from 100 to 175 milligrams per week of testosterone and enthate. Run labs somewhere 10 to 12 weeks after that, so you can kind of dictate what you need to check based off the 4 months prior to that blood work you did. If you saw some things that were deranged in that blood work previously, you know that you probably should check on those things 8 to 12 weeks after ending the cycle in its totality. At that point, 100 to 175 milligrams, you cruise for 8 to 12 weeks. You've seen how kind of this drug burden had affected your body. You know from this data that you can calculate, hey, if I escalate things by another 75 milligrams or 100 milligrams next round, I think I'll probably still get more out of it, and I won't be detrimenting my health as much. This is the key. This is what's going to lead to long-lasting gains. This is what's going to lead to permanent gains, not ones that fall off immediately after ending your cycle. And it's going to lead to a longevity. This is a huge essential thing you need to do: measure consistency, all that stuff, long-term cycles that are lower in dose to get the most gains possible. But most importantly, it keeps us alive and keeps us healthy so that we can continue to do this sport and continue to be bigger and continue to be healthier forever, right? So that's my first cycle recommendation. If you enjoyed it, please like, comment, and subscribe down below. I do try to make these videos as frequently as possible. If you didn't, if you think I'm shit, if you think the first cycle I recommended is shit, comment down below too and tell me why. I'd be interested to converse. Thank you so much. If you have any more content ideas as well, comment those down below. Deuces.